from the station that's on your side. This is Channel 7 News Daybreak.
Welcome back. Colon cancer is one of the most preventable yet least prevented cancers in the U.S. today. It is the third most dangerous, or diagnosed rather, cancer and second leading cause of cancer deaths in both men and women 50 years of age and older. Dr. Laura Lester with Baptist Health Family Clinic Malvern is here to tell us about an option for easy screening. Good morning to you.
Good morning.
This is not always a topic that's easy to talk about for people.
No, it's not.
But this is fairly new.
Yes.
Pretty great way for screening, especially if you want to avoid some of the other things that go along with a colonoscopy.
Yes.
At first, in the very beginning. So let's talk about Cologuard. What is it? And again, fairly new.
Yes, so it's a new option for colon cancer screening, and it's kind of in place of a colonoscopy, which, as you know, you have a long prep. You have to go through a procedure, you know. Cologuard is a kit that you get at your house. I brought the demo kit to show. And so if you don't have any history of colon cancer or any kind of risk factors or anything, and you're just a, you know, normal person needing to be screened, 50 or older, this is an option for you. And it's a kit that comes in the mail. This comes to your house, so it's just you and the kit.
Right.
And you get instructions. This is the actual kit that you get. This goes on your toilet, and you collect your sample and you send it. You call UPS, they come pick it up at your house, or you can drop it off with them, and it goes to the company, and the company analyzes the stool sample, and they can check for any DNA, abnormal DNA, early signs of changes. They can check for blood. They can check for anything abnormal in the stool, and some say that it's really good at detecting early cancers because it'll be in the tissue from the lining, and you may not have a polyp that you see on the colonoscopy.
Ah, okay. So this is, I mean, it's just a bowel movement, right?
It is.
That's it.
Yes.
That's all you're going to need.
That's it. And it comes with step-by-step instructions. You put this. It tells you where to put the stickers on what, and then you just close this up and send it, and you don't have to see anybody else or talk about it or, you know, any of the other embarrassing stuff.
Which a lot of people prefer. You're a doctor,
Yes.
And it's even hard for patients to, in a closed room, talk to their own doctor
and
about it.
And it's very hard to get my patients to agree to a colonoscopy, especially if they're not having symptoms.
So does this completely replace the colonoscopy?
No, not completely. So this is analyzed, and we get a report that says, okay, it's negative, okay, it's positive.
Okay.
If it's negative, you don't have any signs, then you can wait 3 years and do this again, as long as you're still not having any bad symptoms, anything like that.
You need to be aware of your own body.
Yes.
And what's happening.
Be aware of your body. Any changes in your stool, any changes in your, abdominal pain, anything different that's going on. As long as everything's going fine, then you can do this every 3 years and make sure that you don't have any abnormal DNA or anything in your stool. If it is abnormal, you do still need a colonoscopy, but at that point, people are a lot more likely to say, okay, let's do that.
I know, I realize I need this. How do we get our hands on this? We're out of time, but
all you do is ask your doctor, and you sign a form, and they fax it, and then this shows up at your house. Very, very, very simple.
Okay, great information, an easier way for a lot of people to protect themselves against colon cancer. Dr. Lester, thanks so much for being here and bringing along the kit as well.